Welcome to Docs on Call, brought to you by Northeast OBGYN.
Good evening, I'm Elizabeth Nolf McDonald. Welcome to Docs on Call. The majority of gynecological surgeries, the major invasive ones, are still performed using a traditional approach. That approach requires a large incision in the abdomen. The result is post-operative pain and longer hospital stays and recovery times. But that's changing. An amazing new technology now allows gynecologists to perform complex surgical procedures through tiny incisions. It's called Da Vinci surgery, and it's robotic assisted, and it's the way physicians and their patients view gynecological surgery. Tonight, we're going to explore this new technology with Dr. Christopher Stroud of Northeast OBGYN and Parkview Physicians Health. Dr. Stroud, we'll take your questions about what this surgery may mean for you in just a little while. And welcome, Dr. Stroud.
Thank you. It's a pleasure to be back with you.
I love it when you're here. Now, we're going to talk about invasive surgery and minimally invasive surgery, but I want to know, over the years, major invasive surgery has been performed. On what kind of operations is this surgery usually performed?
Well, sure. As you know, I'm an obstetrician gynecologist, so the most common gynecologic surgery that gynecologists perform is probably still the hysterectomy or the removal of the uterus. Other gynecologic surgeries would include removal of the ovaries, repair of things that may be falling through the vagina or through the pelvic floor, such as a prolapsed bladder or a prolapsed uterus or a prolapsed rectum. But by and large, the most common gynecologic surgery performed is probably the hysterectomy.
So that is good to know. Now we are in the era of minimally invasive surgeries. What kind of surgeries do those connect with, and what is the definition of minimally invasive?
Sure. Well, this is most definitely an example of when less is more. So we're still talking about the same kind of surgeries, but we're talking about doing them in different ways that are less invasive. By way of example, if we think of a flu shot as one extreme and maybe removal of the gallbladder as the other extreme, certainly you could see that a flu shot is less invasive than having the gallbladder removed. So what we're talking about when we say minimally invasive is finding the least intrusive, the least invasive way to accomplish the surgery that needs to be done.
And then the advantage of that is, as I mentioned at the very beginning, shorter hospital stays, less pain. What other advantage?
Well, again, the word less is critical there. So we mean less time in the hospital, less time away from work and family, less need for post-operative pain medication, and most importantly, less risk of complications from the surgery.
We have many types of surgery, and we're going to go into that a little bit later, but let's start with the brand new thing that you want to talk about, the Da Vinci Robotic System. Would you explain that?
Sure. The Da Vinci robot is a new technology that's dramatically changed the way gynecologists and their patients view gynecologic surgery. And it allows the surgeon to perform complicated, complex surgeries through tiny Band-Aid incisions. And I actually have a video clip that I think may give us a good example of how the technology works.
Right.
If you see, the screen is split in two, and in the top half of the screen you can see that the surgeon is actually manipulating instruments and sewing in something that's about the size of a human vessel. Now, interestingly, the suture, or the thread that's being used, is a little bit smaller than a human hair. Very small. It would be tough to watch that with the naked eye. The Da Vinci robot allows a 10 times magnification and a three-dimensional view at that. But as you can see in the lower half of the screen, as the surgeon moves his fingers and his hands, the tiny, specially made instruments move in exactly the same way. And this is being done through very small Band-Aid sized incisions.
How long did it take you to learn to do that?
Well, you know, the learning curve, as we say with the Da Vinci, varies by surgeon and varies by procedure. But it does require the surgeon to invest some time and some patience in advanced training to get comfortable with the technology, to be able to use it in a safe and an effective way.
Now, what are we watching right here? This is a hysterectomy, or what is this?
No, this is actually a demonstration of sewing together a blood vessel. So this is something that would be very similar to bypass or open heart surgery being done with the Da Vinci robot.
When I was at Tapestry a few months ago, you were there, and you had this machine.
We did. We had the robot there to demonstrate.
And you were So excited, and you were having people sit in there and manipulate it. Now, I stood in line and didn't do it. Thought maybe you'd give me a, I don't know, my own personal chance to do that sometime when I come to visit your office. But what were the reactions of the people who did that, who saw that?
I think patients are amazed that something so complex and almost microscopic could be accomplished with relative ease from a distance away. You know, the surgeon is sitting in a console, and how the surgeon moves his or her hands and fingers, that movement is directly and specifically translated into the instruments in an amazingly accurate way.
Now, when you were going to be a gynecologist, did you even think years from now, not that you've been in that long, that you would be performing surgeries with a robot?
Absolutely not. You know, when in the last few years, the most similar technology has been the advent of the laparoscope or laparoscopic surgery, and the Da Vinci robot is really an advance beyond the laparoscope. So the laparoscope involves a small incision in the belly button where a camera is inserted, and then two small incisions off to either side where instruments can be inserted. The instruments are rather rudimentary and simple. I always tell patients it's similar to trying to turn a light switch on or off from across the room with a broomstick. It can be done, but it's challenging. And as the surgeon moves his or her hand to the right, the instrument moves to the left in the opposite direction.
The right-left thing.
So it's very complicated. But that was a tremendous advent over the old-fashioned traditional abdominal incision to perform surgery. Now the Da Vinci is an even bigger advancement on top of that technology.
I'd like to know the difference between the laparoscopic surgery and the Da Vinci, because I had a relative who had a hysterectomy just a few years ago, and she was up and walking around, and she was in her late 80s, 2-3 days later, and I remember when women had hysterectomies, and some still do, where they are bedridden for quite a while because of the major surgery.
Sure.
So if she would have had the Da Vinci rather than the laparoscopy, what would have been the difference?
Well, that's a great question. I mean, commonly we see our Da Vinci hysterectomy patients. They may go home the same evening of their surgery, or most definitely the next morning following their surgery. They need very little, if any, pain medication following the surgery. And I have patients that are back to their full-time work within 2 to 3 weeks and feeling good and back to their preoperative level of activity.
If they would have had a laparoscopic surgery, what would have been the difference?
You know, I think as we think about that question, the differences may not be that great. What is vastly different is the type of surgery that the gynecologist could achieve with the robot. Conventional laparoscopic surgery is limited by the patient's size, by maybe the size of the organ that needs to be operated on. For instance, with a hysterectomy, if the uterus is very large, if there's scar tissue or endometriosis or other types of problems, the laparoscope may be limiting in its ability to assist, causing the surgeon to have to resort to the old-fashioned traditional incision, whereas the Da Vinci robot instead would allow the patient to feel as though they've had laparoscopic surgery.
So this is wonderful news with women with endometriosis and other conditions that they had to have major surgery before.
Absolutely. And you know, interestingly, there are about 600,000 hysterectomies performed in America each year. Sadly, 2/3 of them, or just over 2/3, are still performed with the traditional incision in the abdomen.
Why is that?
You know, it's a good question. I think technology can be slow sometimes to make its way into the practice of medicine. Utilizing the Da Vinci robot requires the surgeon to spend some considerable time to develop the expertise to be able to use this in a safe and an effective manner. But I think increasingly we're seeing that change locally and nationally.
So Northeast OB/GYN, do all the doctors use the Da Vinci at this point, or are some of them still in the learning curve?
I would say people are using it in different ways within our practice of physicians. There are some who use it for more specific types and more complicated surgeries than others. But certainly all of the physicians at Northeast OB/GYN are interested in performing surgery in the least invasive way possible.
What other surgeries can be performed with the Da Vinci?
Yeah, probably the most common and the one that our viewers will hear most about occurs in urology where the prostate is removed, or a prostatectomy.
Okay, now we're bringing the men in.
Absolutely.
That's good. Come watch the show.
In days gone by, the only way really to have the prostate removed for prostate cancer was to have a very large surgery with an up and down midline incision with all of the problems that go along with that. Now it is very standard to have the prostate removed utilizing the Da Vinci robotic technology.
You were saying that it is performed with very tiny incisions. Where are those incisions?
Yeah, the incision location varies a little bit by the surgery, but in gynecology those typically occur right at the level of the belly button and sort of in a semi-arc to either side of the belly button. Patients will often say they feel like they've been in a fight with someone who had darts, because they'll have a Band-Aid on their belly button, 2 Band-Aids off to one side, and 2 Band-Aids off to the other side.
The advantages of not having abdominal surgery, wouldn't that also mean that a person's muscles, abdominal muscles, would be intact with the Da Vinci?
Absolutely, which is part of the reason we have less pain, less need for pain medication, and less time to get back to work and play.
Do people's abdominal muscles ever reform after major abdominal surgery?
Oh, certainly they do, but as anyone who's had surgery knows, there's some pain that goes along with that reforming and healing.
Well, let's talk about hysterectomies. When do people know that they need them?
There are many different indications for a hysterectomy. One of the things we should point out is the terminology can be challenging in that hysterectomy means removal of the uterus, not removal of the ovaries necessarily. That's a separate surgery that's sometimes done at the same time of hysterectomy. But probably the most common cause to remove the uterus or perform a hysterectomy is related to bleeding, abnormal bleeding patterns. Pain is also another reason, some painful conditions such as endometriosis that you mentioned earlier. Pelvic organ prolapse, when the uterus or the bladder or things are prolapsing through the vagina. Those are the major causes, or the major indications, as we say, for a hysterectomy.
When a person believes or is told that she is going to have a hysterectomy, what options are available to her?
Well, there are really just a few basic ways to accomplish that surgery. There is the traditional, or the more standard abdominal approach. That involves making a incision in the abdomen. And as I said, just over 2/3 in America, the hysterectomies are performed utilizing that approach. Then there's the vaginal hysterectomy, where the uterus is removed through the vagina. That's certainly less invasive than the abdominal approach. And then there is the laparoscopic assisted approach, as we mentioned earlier. The Da Vinci then would be an extension of the laparoscopic approach that we were talking about.
That's very interesting. If a person were to have conventional laparoscopic surgery, what are the possibilities that that would not succeed versus, say, the Da Vinci?
Well, that's a tough question to answer, I think. There are limiting factors with laparoscopy. As I mentioned earlier, if the patient is very large, if we're trying to remove the uterus and the uterus is very large, that can be a limiting factor. And again, the Da Vinci robotic technology allows you to extend the technology of the simple laparoscope.
I'm amazed that more surgeries are not performed with the Da Vinci. How long has that been out?
The Da Vinci has been out several years now, and it's in its second generation, you might say, of the technology, and it's becoming rapidly sort of the new standard for gynecology surgery, for many things in urology, and for cardiac surgery and other specialties as well.
Wonderful. Sarah has a question for you, Doctor. Go ahead, Sarah. Ask Dr. Stroud your question.
Hi, Doctor. I am 47 years old. I went through menopause when I was 36. And I was wondering, when do you know when you can stop taking birth control pills?
Good question. Thanks for your call. The question is, when are you no longer fertile? And that's a common question that comes up. Certainly if your menses have occurred no more, and it has been from 4 to 6 months without periods, typically one can assume that one is no longer able to conceive. There is a simple blood test that we can do in the office that can give you a little better and a little more secure answer, though, and I would recommend pursuing that with your gynecologist.
Okay, thank you very much.
Thank you. Thanks for your call.
Thank you, Sarah.